You were nice this time, so thank you. So I told somebody that I was speaking at the kickoff lunch that I was really close to, and they said, so you couldn't find anybody better. There may be a certain degree of accuracy there, but this has been I've been with this organization for 10 years, and it's been remarkable. With all of you that we've worked with, and a step-by-step, piece-by-piece, and I know with the walk, it all gets busy and wild, so I just wanted to take a few minutes to recognize where we've been and where we're going. I'm going to set my timer so I don't get in trouble with Sandra Mahalish. Sandra used to boss me around on the swim team when I was 5, and I'm still a little bit afraid of it. So, thankfully, she doesn't make me run around Sun Haven selling chocolate bars for $1 anymore. Although I may have just gave her that idea back. The best thing that NAMI does is our education groups like family to family and peer to peer, and our support groups. So I'd like to take a second and ask everybody to stand up if you've been a NAMI facilitator or a trainer of any of our signature programs. Thank you so much. I can say that every time they give one of those courses, there's a life saved in that room. Somebody understands how to care for their family member better. Someone stands out, understands how to support their own recovery in a way that they wouldn't otherwise. But I'm not going to focus on what we do best. I'm going to focus on some of the other things that we've done over the years. But I think it's important to start out with why we've been able to accomplish things as a team. And I think that a lot of it comes down to the NAMI organization has good bones. I think if you have an organization that isn't set up right from the beginning, it's so hard to do anything else right. But if you've got a good foundation, if you've got it lined up, it's amazing what you can do with your partners, and it's amazing who will come to you and who to work with you. And NAMI was founded in the 70s by a bunch of mothers of children with schizophrenia. And their focus on compassion and empathy and science is what's driven us forward. That pure, clean statement that we can do better, and we have to. Which, as any of you that knows a NAMI mommy well, that is exactly what they still say every day. Sometimes in our office phone, a little bit harshly. I try to figure out how to explain what we've done and how to break things up, and I didn't think it really worked chronologically, because we're a little bit all over the board. So I try to break it up into 4 categories. Early intervention and awareness is the first one. Finding and paying for care. The tough one is commitment, suicide in the criminal justice system. And then the last one is building towards the future. I still don't think it totally makes sense, but I'm just going to roll with those 4, and hopefully you can track them. One of the main things that we started out with was awareness. 10 years ago, there was not a significant amount of understanding about brain conditions. I know when the Montana National Guard had to care for its returning service members. They didn't understand PTSD. They had no idea. And I'll tell you, I was very angry and saddened at the time, but I will just say, as a society, we weren't ready. And we still are trying to get better, but a big push was the awareness. And with our walks and presentations, a YouTube channel that's had more than 63,000 views, we're building it, but it is with good partners. We've had amazing members of the media that want to help, that want to tell the story, and people that are willing to step up and say, this is what happened to me. This is what happened to our family. Over and over, year in, year out, no matter when we call them and beg and say, can you cover this interview? Somebody always steps up. One of the first big achievements that we had was congressional legislative move through Congress with Senator Max Baucus and Ted Kennedy, and it was to improve the screening process for every returning service member in the country. And when my stepbrother came back, it was a joke. Literally, they got a group of people in a room and asked if anybody had any mental problems. The answer were jokes, and probably pretty funny, but it set people up to have lives that spun out of control when they came back home. So that bill was signed into law on October 8th of 2009, and it's been in place for the entire military since then. We're incredibly thankful to have made that step. Another one in early intervention and awareness was the Youth Aware of Mental Health program. We really wanted new, better research in the state of Montana. So we had to start a research center. Thankfully, Montana State took it on. Dr. Matt Byerly came and was the director of the center. And then we looked around to see what was the best intervention in the world for high school kids. The Youth Aware of Mental Health program had just been published in the Lancet, and it was the best in the world. No one in the United States had it. Because we had a research center, we got it before anyone else in the country. And because the Helena School District was willing to step up and care for kids at Helena High and Capitol High in the most cutting-edge way possible, we not only got that program, but we got it to run. And that was these partnerships. And the data keeps coming back, and we're hoping for publication soon, but the results are phenomenal, especially in some of the small schools, and we're excited to see those continue. Representative Marianne Dunwell is in the room, and she's agreed to carry a bill at the next session to continue YAM and the PAC's Good Behavior Game, continue to care for Montana's kids. One of the other projects that we were able to work on was the Montana Crisis Action Toolkit on suicide. This was the brainchild of Tiff Hansen, and she realized that after they lost her niece to suicide in Missoula, schools didn't know what to do after the fact. It was just so hard. So she said, we're going to bring in the nation's best expert to Montana, and we're going to get him to train the Montana schools. And she found Dr. Scott Poland, brought him to Montana to OPI, which then led us to ask him to work with Big Sky ACAP to write the Montana Crisis Action Toolkit on suicide to train every school in the state of Montana on how to prevent suicide, but also how to react to it. And really excited and thankful to point out that Shodair Hospital, one of our NAMI heroes, has paid for a Montana Crisis Action Toolkit to go to every school in the state of Montana. It's an amazing investment on their part, and just an example of what we can do together that we couldn't have done alone. Boy, I've got this huge list, so let me keep trying to dig in. For finding and paying for care, we were able to help get peer support in the state of Montana with Dr. Nathan Munn and Montana Peer Network and the Montana Mental Health Trust. The same thing with youth crisis beds, with the Children's Bureau. Service animals, we have the only person that's fought the VA, the Department of Defense, and the FAA in the back of the room, Alicia Smith. I don't know who she's taking on next, but I would want to be in their shoes. Two of the projects that we did were just the realization by having people call us all the time that people don't know how to find care. It's so hard to navigate through the treatment system. So we were able to work with Montana Social Workers Association to develop the resource guide for every county in the state of Montana. So wherever you were, you could get on our website, find your county, and see where to go to get help. It was based off of a resource guide developed in Kalispell by NAMI Flathead, by people who live with mental illness that knew this is what we need to know. We don't need to know everything else. This is what we needed. So we copied theirs for every county in the state. We also worked to develop the Treatment Scout website. And what the Treatment Scout website is just like TripAdvisor for every residential treatment program in the country. And if you're a family in Montana looking to go get care at a residential treatment center, you can go on there, find reviews, find locations. We felt that this could be a $20,000 or $40,000 investment. You should at least be able to have enough info as you do when you're trying to find a hotel room. It's just pretty standard, but we also, in memory of Scott Hannon, expanded it out for veterans. And the Cohen Veterans Bioscience has just decided this week to highlight Treatment Scout on their website. They're one of the most cutting edge groups in the country, and they think Treatment Scout for veterans is as good as it gets. So we're really excited about that. We were able to work with Blue Cross Blue Shield, Commissioner Matt Rosendale, Lori Bishop, and the entire Montana legislature to pass the Montana Mental Health Parity Act. Chris Hedges, from Blue Cross Blue Shield, we were one of the few states in the country that was able to pass a Parity Act. And it was for the basic reason that we were able to sit at a table with Blue Cross Blue Shield and figure out what works. Not just get a bunch of weird language from other states, although we tried that before Chris shot us down. And then, but we stayed at the table and went back and forth, and there were members of the legislature that would not let this die, even though it was not politically where the winds were blowing. And one of the other programs that's just been released is the online cognitive behavioral therapy called Thrive. And this was a program that's been out there for adults for about a year, and it's just been funded by DPHHS. They are looking to submit the data from last year to the New England Journal of Medicine, and the results are astonishing. I mean, really amazing. It's online cognitive behavioral therapy. You can take it from anywhere in Montana that has a computer with the internet. And the results are as good as antidepressants. They're as good as therapy. It's not there to replace those, but it's another tool. And it's really exciting that we were able to bring it to Montana right away because of that research center and Dr. Matt Byerly. Next, I'm going to move into our commitments, suicide in the criminal justice system. The reality is mental illness is harsh. Mental illness is scary, it can be terrifying. And at some point, people can lose the ability to care for themselves. And we worked with Representative Ellie Hill and Mike Minahan to change the law so when people could get care when they couldn't care for themselves, because we didn't believe that it was okay to just let them die because they couldn't care for themselves. And Dr. Garrett Mahelish and folks from across the state pushed that through for years. We were very thankful to be able to do it. That was a miserable process. We were also very thankful to have that one signed and never have to do it again. We worked with Dr. Lynn Lance and Aware and Big Sky ACAP to establish the Montana Suicide Review Team. So the reality is if you don't know why people are killing themselves, you can't design programs to prevent them. And then Dr. Len Lance again and Big Sky ACAP and Heather Zalewski from Chaudere worked together to do the Montana Conference on Suicide Prevention, a very specific targeted conference that brings real-world tools that people can go back home and implement in their communities that day, that week. And it's been an amazing conference. There was like 400 people at the last event, 800 if you count like Kurt Chisholm. But it's been amazing to see it pick up steam, and it's only starting. One of the hardest things for me with answering the phone in the NAMI office is for mothers with children in the criminal justice system. And the ones that have haunted me the worst have been mothers with children with schizophrenia at Montana State Prison in solitary confinement for days and weeks. The most horrible, excruciating event that a family could go through, I think, past death, and that's coming from someone that's lost someone to mental illness, is those weeks of having them there. And NAMI Montana fought to develop a forensic unit. And we worked with the governor and AMDD and DPHHS. And there's a place where people can go so they don't have to be in solitary confinement. We can't get everybody in there that we need to, but there's a place. And we're deeply grateful to everybody that worked for that. And another project with the criminal justice system, Senator Representative Mary Cafaro. Mary worked with us to change the, way in the back, all right. Mary worked with us to change the parole system, to make it so someone had to be on it that understood mental illness. With the level of incarceration that our people have in this state. It does not make sense to just leave it to a committee that doesn't know and care about this. And we're deeply grateful to Mary for her efforts on that. So now I want to finish up with building towards the future. I do believe that we are only starting. It's been a long 10 years, but we're only building up steam, and we're building up steam together as a group. And some of those projects are in working with technologies. NAMI Montana was fortunate to work with Dr. Christoph Lambert at the University of New Mexico to do the biggest big data analysis of bipolar disorder in history. Millions of electronic medical records. NAMI Montana's been able to partner with them to see what they should study, what we can learn, and it's been an amazing process, and we can't wait to see where that goes. And then we partnered with the Billings Clinic to help develop a psychiatry clinic or a psychiatric residency program in Billings. The next wave of Montana psychiatrists are going to come from that psychiatric residency program with Dr. Eric Arzubi and their team. If we don't have people to care for our folks, they will not get the care that they need. If Chaudère can't get the psychiatrists that they need, St. Peter's, the VA, we need to build that pipeline, and we're very excited that that partnership is coming into fruition. The students start in March, and they'll be in Montana, I think, in 2022. But finally, we have two veterans initiatives that we're very excited about. And remember that I said that we worked with Commissioner Rosendale earlier. Now this is with Senator Tester. So I'm highlighting both of them for anybody that's paying attention to the legal challenges that nonprofits have. So we work with everybody. But we've been working with Senator Tester for years with veterans, and we've got an initiative that we hope will be signed into law in 2019, requiring the VA and the Department of Defense to have 2 biological brain health indicators ready for clinical treatment by 2023. That will change how we care for brain conditions. And we worked with Emily Blair from our national office. We have senators on both sides lining up to support that. We've worked with some world-leading veterans research organizations. It's going to be exciting. And it's not going to be everything, but it's going to be a step towards tangibility and knowledge and improving the quality of care through science. And then the last one is Senator Tester put NAMI Montana up to be on the creating options for veterans expedited recovery commission. It's a national commission with about 9 people on it. And out of all the organizations in the country, we've got a shot. We've got a shot to change how our country cares for our veterans. This little tiny nonprofit in Montana. And it's because of you. It's because of us, and we're only starting. Thank you.